Dr. Dan Neumann. I'm a general surgeon here at Good Samaritan Hospital. We do a pretty wide variety of procedures. We do, take off skin lumps and bumps, skin cancers, drain abscesses, and do a wide variety of intra-abdominal surgery, including open and laparoscopic hernia repairs, laparoscopic gallbladder surgery, laparoscopically assisted colon surgeries. Do a little bit of breast surgery and do some, along with Dr. Young and Marvin Kebby, do a lot of access procedures for our fairly busy nephrology service here at Good Samaritan Hospital. When you go through after your first couple years of medical school, then you start doing rotations where you're with certain specialties. And I remember when I was with pediatrics on that rotation, that was my first clinical rotation. I thought, well, maybe I want to do pediatrics. Then you keep moving on, and every one you kind of think you might want to do. But eventually I settled on general surgery. I knew that that's what I wanted to do. One of the things I like about that and it's not true of every case involving surgery, but compared to medical patients who kind of have chronic problems, recurring problems, where the doctor's always seeing them back for their diabetes or their high blood pressure, their heart problems. For surgeons, you can usually do a procedure for a certain specific problem, and then you don't have to see them back. You've kind of cured those patients. Not all of them, but something. I think we have a higher percentage of that where we don't always have to keep seeing them back forever. I love my job, I guess, because of the interaction with people. We get to care for and get to know patients. And even though I mentioned previously that you do an operation, then you don't have to see them again, there is repeat business, so to speak, where if they trust you, they'll come back to you for other things in the future, and you do get to know patients that way. And working with staff, colleagues, that's all enjoyable part of it.